The GAD or the Generalized Anxiety Disorder is the most common anxiety disorder among adolescents. It is an excessive worry about a number of things for 6 months or longer. It is often referred to as worrywarts. While panic disorder is the recurrent, unexpected attacks of anxiety, the SAD or the social anxiety disorder or social phobia is a worry about being laughed at or embarrassed or doing something humiliating in front of others. The SM or selective mutism is the excessive anxiety or inhibition about speaking to the point of mutism. Special phobias is a consuming fear of a specific object, like fear of the heights and fear of being in an enclosed place. While separation anxiety disorder is a worry that something bad will happen to them or their parent or primary caregiver when not together. The DSM-5 diagnostic criteria for generalized anxiety disorder or the GOD is excessive anxiety or worry more days than not for at least 6 months, and it's difficult to control. Anxiety and worry are associated with greater than or equal to three of the following: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance. And the DSM-5 criteria for panic disorder is that a panic attack is an abrupt surge of intense fear or intense discomfort within minutes and with at least four of the following: palpitations, sweating, trembling, sensation of shortness of breath or smothering, feelings of chest pain, nausea, feeling dizzy, chills, paresthesia, feeling of unreality, or being detached from oneself, fear of losing control or going crazy, and fear of dying. So, here are some of the examples of symptoms of panic disorder. Lab workups like CBC, thyroid function test, ECG, and chest X-ray are needed to rule out any medical condition. If with normal results and cannot be explained by any medical condition, anxiety disorder is most likely. The screening tool commonly used is GOD-7. It has 7 items answered by 3, 2, 1, and 0. GOD-7 by Spitzer et al. Was developed in 2006 with 7 items and can be answered in 2 minutes. It's a screening tool and presents severity indicator for GOD. Its sensitivity is 89% and specificity of 82%. It is also a good screening tool for other common anxiety disorder. Here is the scoring of GOD-7. The score of less than 5 is minimal, 5 to 9 mild, 10 to 14 moderate, 15 severe. The score of 10 and above is a probable diagnosis of general anxiety disorder and can be confirmed by further evaluation. For the treatment, it is important to ensure safety, especially given the high comorbidity between anxiety disorders and mood disorders or substance abuse disorder, and to rule out having suicidal tendencies. Then, identify and address stressors and psychoeducation. Psychoeducation is the first step in management of anxiety disorders. Its aims is to give patient knowledge about the disorder. It is important also for their families to understand what anxiety disorder is and impact in day-to-day functioning. It is to understand the importance of facing fears and learning the coping strategies. The main treatment for anxiety disorder is psychotherapy and pharmacotherapy. In starting medications for anxiety disorder, it is important to note any side effects and monitoring. For mild anxiety disorders, treatment will be psychoeducation and cognitive behavioral therapy or CBT, which has the strongest evidence base for the treatment of youth anxiety disorders. For moderate to severe anxiety disorders, psychotherapy and SSRI or the selective serotonin reuptake inhibitors are recommended. CBT focuses on identifying, challenging, and revising anxious thoughts into more adaptive ones. It is focused on here and now and focusing on the specific problems being worked on. CBT is done by trained mental health professionals. Other psychotherapy that can be used are acceptance therapy, which gives the affected person the skills to accept unwanted thoughts, feelings, and sensations. Mindfulness based therapy, which is living in the moment and experiencing things without judgment. And exposure therapy, becoming less sensitive to feared situation or stimuli. For pharmacotherapy, the SSRIs are the mainstay of medication management for anxiety disorders. It prevents the uptake of serotonin in the brain by stabilizing serotonin levels. It decreases anxiety, regulates mood, and improves sleep, making them effective in managing anxiety. We as pediatricians can do initial management by active listening without judgment, giving advice on self care by eating healthy foods, good sleep hygiene, and encouraging exercise. Teaching them coping strategies by doing pleasant activities that makes them relax, like listening to music or watch favorite video. By instructing them to do relaxation technique like deep breathing exercise and muscle tension relaxation. And for moderate to severe anxiety, refer to psychiatrists for further evaluation and management. And for my key message, anxiety is a common and natural part of life, but when level of anxiety or worry is excessive and interferes with function, it can be a common mental health disorders of adolescents. It is always important to screen for anxiety disorder. Treatment approaches should include ensuring safety and psychoeducation, and identify patients need to be referred to mental health professionals. Smile, breathe, and go slowly. Thank you.